All right, what do you think?
Ooh, it was good.
You like it?
I felt like it flowed.
Okay.
Yeah. That's what I'm always nervous about. I'm like, is it going to flow?
Explosion.
Hey, this is Richard Zombeck, and you're listening to Buds with Suds, and this is episode 25. Before I introduce the guest for this episode, I do want to do a quick shout out to Jess Mulvey, who is one of the recovery coaches at North Shore Medical Center. And she also happened to be a guest on this show in episode 12 that you can hear along with all of our episodes on budswithsuds.com, Spotify, iTunes, and YouTube. She graduated this past weekend. The ceremony was this past weekend. Graduated summa cum laude with a degree in addictions counseling. Now, a little bit of housekeeping is North Shore Medical Center, where I am the recovery coach supervisor, is taking interns. So anyone who is at North Shore Community College and took the CARC, Recovery Coach Certification Program, shoot me an email at rzombeck@partners.org if you would be interested in doing an internship to get your hours and supervision for that certification. And now that the little bit of housekeeping is out of the way, our guest, or my guest, on this episode of Buds with Suds is Tisha Goullaud. She is, first and foremost, a mother of 3 children and in recovery herself. She's a peer mom and a lead recovery coach at Lynn Community Health Center and helps moms find stable recovery on a path that's most suitable for them. She does care coordination with outside agencies and supports moms through labor, delivery, and postpartum. I think you'll find in this interview, Tisha is a very strong woman. She takes her job very seriously. She takes motherhood very seriously, and I think by the end of this interview, you'll be about as impressed as I was with her. Tisha, welcome to Buds with Sud. Welcome to the show. I've been trying for 2 years to get you on here.
Yeah.
Then we had the pandemic, which has been fun, I think, particularly for people in our field. Have you guys seen an uptick in cases, or has stuff pretty much remained the same?
Lynn's always been like a hot spot, so I feel like it's the same. And I haven't had a lot of like people that I work with specifically that have had like COVID. And I work with a lot of like homeless and people who like aren't good at wearing masks. And
you know what's really funny, and I think you're the first person I've talked to on the podcast about this. And I want to bounce this off you, because what I've noticed, particularly in recovery, is like people who have, I don't want to say really long-term recovery, but people that have kind of a base of recovery have probably dealt with this better than most. Do you find that?
in some sense, yes. Like, I think that I feel like I have a good base of recovery, and I feel like I've dealt with this really well. Like, I've been able to manage like shifting from in-person to online supports or whatever I need to do. But I think at the same time, like, my recovery depends on connection. Like, it depends on being with other people who are in recovery, like on a regular basis. And so I've seen that both like in my personal life and in the work, that it's become like problematic, this going this long without like being around other humans, which is like crazy. But so in one sense, I feel like we're prepared for anything. Like, I feel like I'm prepared for doomsday because I'm in recovery. So like, I feel like I'll handle anything.
Exactly.
Like,
I've been practicing for this my whole life. What's wrong with you?
Keep it moving. But in the other sense, like, I feel like specifically for people who are either in recovery or trying to get into recovery or in use or whatever they're in, I feel like this has really been really devastating for them as well. So for me.
Well, I think people who are new to sobriety and recovery, it's been like a major shift, right? But I think that the people that I've come across, I I was talking to a therapist who was like, how are people like you doing? And I'm like, and this was like 6 months into the pandemic, right? It's like, well, that feeling you get when you go into a supermarket and everyone's afraid and you're afraid and you have impending doom. That's pretty much how I feel my entire life, right?
Yeah, that's
so
pretty
it's
much
like
baseline.
So it's like now you know how I feel,
Yep.
right?
Yep.
And people who have like 5, 6, 7 years are like, I think up until probably maybe 3 months ago, like people that I knew that were in recovery for a good period of time were kind of like, I don't know what the problem is.
Yeah. Well, I just feel like I just adapted. Like I have my entire time in recovery. I've just had to adapt. I had to adapt to living in a residential program. I had to adapt to moving out of that program. And so I feel like I'm constantly adapting. So that feels really normal to me, to just have to adapt to a new way of life. Like I spent so long using drugs and alcohol, and then I had to adapt to like being a productive member of society. So like to adapt to a whole new way of life is like totally familiar to me.
And are you? Do you think you're? No, I'm kidding. Are we,
Somewhat.
Are we really productive members of society? Like I always feel like I'm getting away with something. So you work at Lynn Community Health, and a lot of the questions I have are going to be ignorant and naive because I don't. I've worked with you, and you and I have communicated about patients that we have in common, and I think we've seen each other on different events. Or actually, you came to Salem Hospital and did a Schwartz rounds, right? And I had done like 3 or 4 of those before I even started this job. So, Lynn Community Health, and you work primarily with pregnant moms.
Yeah.
Right?
Primarily pregnant, postpartum, and anyone that has a child under 3 years old. So they don't necessarily have to have custody of that child, but the child needs to be under 3 years old. So mostly I work with moms.
And all people with substance use disorder.
Yes.
Right? I mean, that's kind of the key.
Yes. And so actually, originally it was only with women who struggled with opiate use disorder specifically. And now we've sort of opened it up to include pretty much all substance use disorders.
And what kind of floodgate did that open?
Well, I don't look at it as like a floodgate, as more of like an opportunity, because we had so many moms that were struggling with like cocaine or alcohol and things like that. And like, you just kind of feel like you gotta just kind of like, oh, sorry, I can't help you because of these criteria to enroll and things like that. But
yeah, I think what I was getting at was, a lot of these programs were initially started to address the opioid crisis. And in our case, for example, I would say like 70% is alcohol.
Yes.
Right? And there's a huge issue with alcohol.
Yes.
We get overdoses and opioid stuff, but not to the degree that we get alcohol use.
Yeah.
So I feel like this kind of need or want or urgency to address the opioid crisis, which, which really only needed to be addressed when rich white kids started overdosing from fentanyl, right?
Yep.
Was fortuitous for the rest of us because my thing was always alcohol, right? Mm-hmm. And most of the guys that I work with, I say guys because I'm old and I refer to everyone as guys, right? All of my recovery coaches pretty much struggled with alcohol, and most of the people that we see are struggling with alcohol, be it in the emergency room or from the primary care facilities or on the medical floors. So my experience, and I'm gonna guess that there are some differences and I don't know them, so you're gonna have to kind of guide me through this as to what exactly is your specialty. And a really stupid question is, how is that different? And where a child is involved, how does that all kind of play in together? And I think, I'm not speaking for everyone, but I in particular am kind of interested in the aspects of pregnancy and drug and alcohol use during pregnancy and what that all looks like and where your role comes in.
Yeah, that's a really loaded question. So let me see where I start. So I think absolutely, like so what I do, I feel like, is a niche of recovery coaching, right? So it's sort of specialized because, and I work with other recovery coaches who just work like on our complex addictions team. And so see, grandma who like takes too many pain pills to the person that's like shooting meth to, all kinds of different people who struggle with substance use. And I work specifically with moms. So I would say the biggest difference is like the amount of care coordination I do. So the amount of coordination I do with moms and getting them physical needs. So whether that's helping them fill out an application for EA shelter or making sure they have housing or food stamps or whatever they may need to be able to like function as a human being, right? They're like basic needs. And then care coordination with DCF, I would say, is like the biggest difference. Probably right now on my phone, I probably have like 20 voicemails from DCF workers that want to check in about different cases that they may have open that I might be working with. And I feel like that's a really tough job as a recovery coach because the DCF always wants to know like specifics, right? They want to know specifically how I think somebody's doing. And I really don't feel comfortable sharing like my opinion. So that was sort of a learning curve that I had to go on because constantly the question is, how is so-and-so doing in their recovery? And I'm sort of like, well, I can tell you like what I observe. And what I observe is they never seem under the influence. They never seem lethargic or overly tired or, and I can tell you what I've seen them do for their recovery and what they've told me they've done for their recovery. So whether that's 12-step meetings or they go to an IOP or whatever they may be doing for their recovery. And then they sort of push a little bit of like, but what's your opinion? Do you think they're doing well? And I'm just sort of like, I can give you the facts of what I know.
So just for well, I don't know if it's accuracy's sake, but is there anything in your job or related to any of the grants that are funding this particular coaching job that compel you to respond to these requests, or can you push back? And is your role mostly to advocate for the person? I as usual, I don't like the word patient, recovery. What's the other one? Participant,
client.
Yeah, I just
same.
I just talk. They're people.
Same. Yeah.
So the people that you're working with, right? Is there? I mean, the recovery coach job, the model of the recovery coach job, is to advocate for the person, right? And so, but we also can't lie, right? To a government agency,
right?
But we're also not, I mean, in our role anyway, we're not required by any funding or by any law to respond.
Yeah.
Even an official request, right? But the thing is then you're caught in, my response is going to be helpful because they want this to work out for them in a positive way. And if I don't respond at all, the assumption is going to be negative.
Right.
Right. Okay.
Right. 100%. Yeah. And no, it is in my job description to like coordinate with outside agencies and things like that. And, there are other sites throughout the state in this, of this particular grant. And, other sites operate differently. Like I know another site, locally that, their recovery coaches don't speak to DCF. And I just feel like in order to properly advocate for my patients, like I have to have that open line of communication with DCF. And I think it's like a slippery slope, right? Because like one minute somebody's doing amazing and you're singing their praises to DCF. And then like the next minute, something goes wrong and then you can't lie. So, but I think the benefits outweigh the consequences. So I feel like I'd rather have that open line of communication with DCF to be able to truly walk somebody through that process, because it's really isolating. I've been through it myself. I have custody removed from me of my daughter, and I felt like alone. Like I felt like there was nobody there on my side, because it can really be set up to feel like there are sides. Like there's a DCF side and there's your side. And so in order for me to be able to like sit side by side with somebody and like really walk them through, I feel like I have to open that line of communication with DCF. So
so how is that relationship? And I'm again a loaded question, because I joke with all of our social workers that they basically, all they do is take away kids, right? And so I think there's the same kind of feeling about DCF,
Yes.
is that they're just there to break up families. But I would say in a lot of instances that I've had to deal with DCF, they've been pretty cool okay.
yeah,
So
yes and no. I think the issue is education in DCF. I think
for those of you that are just listening, Tisha's head was kind of bobbing back and forth.
Yeah. I mean, I think it's just a lack of information available to the department, like about substance use disorders, about recovery, about domestic violence and interpersonal violence, and the really like intricate like relationships that form in those situations. And I think that like our local DCF office in Lynn has been amazing. We've done a number of trainings with them about medications for opioid use disorder and domestic violence, and what recovery looks like, and how different recovery paths can look different. And because I think they're operating honestly in like a 1950s idea of what a substance use disorder and what recovery looks like. So, for them, recovery is always, are you going to meetings? Do you have a sponsor? And all these things. And I'm trying to push DCF workers to sort of expand.
Are you 100% abstinent?
Yes,
Yeah.
exactly.
Yeah, that's the big one.
Yep.
That's and
do you have the screens to prove it?
right.
Yeah.
So you're dealing with that.
Yes.
And so I'm assuming that there's some re-education going on.
Yes, but that's a two-way street too. So I do a lot of re-education with moms too about DCF and about the fact that like at the end of the day, all they want is for a child to be safe, right? So like I always say, you couldn't pay me $1 million a year to be a DCF worker, because literally you're making life and death decisions for a child on a daily basis, and I would never want that job. So I do have a lot of respect for the work that they do. And I think that sometimes it's really helpful for moms to hear that perspective from somebody who's had their child taken away. You know what I mean? Somebody who's been there and can identify with how traumatic and devastating that can feel, and at the same time really address DCF's concerns.
So in your case, do you think it was warranted?
Yes. Looking back, if you asked me that 4 years ago,
yeah, of course.
I would have said no, absolutely not.
Right.
But hindsight's always 20/20, and I think yes, I think when you're dealing with somebody who's doing opiates and is the sole care provider for an infant. My daughter was an infant. It can be really dangerous, right? So if I overdose, what's going to happen to my 3-month-olds? You know what I mean?
Right.
So, and I've had friends that have died while their child was in their care, and the baby's just there waiting for somebody to come find mom dead, which is like devastating. So I think over the course of my recovery, like I've had a lot of perspective changing things that have happened in terms of DCF, and at the same time have also sat in some of the most painful moments of a woman's life in this work. And so I think I have a really well-rounded idea of the DCF system and how it, child welfare and all those things. So, but it's a tightrope that you walk.
So what does that look like? Like, you alluded to sitting with someone and kind of walking them through that. What does that look like?
Mostly it just looks like sitting with somebody who's hysterically crying and just sitting with them and allowing them the space to like have that reaction. Because I remember my reaction, right? So I actually delivered right here at Salem Hospital in the birthplace. And I remember a nurse had come in, and they don't really do this anymore, but a nurse had come in and told me they were taking my daughter to get some shots in the nursery. And they took my daughter out of the room, and 2 seconds later, my phone rang, and it was DCF telling me they had just taken custody of my daughter.
Oh, wow.
And so I was...
So the rumors are true.
Yes. So I was very upset. The nurse came back in trying to apologize, and I threw a water pitcher at her. and Lisa Cavallaro from the birthplace, who's the nurse manager over there, had come in, and I thought she was going to kick me out. I thought she was going to tell me I had to leave because I was being abusive to her staff. But she actually just like sat on my bed with me and like held my hand and told me that I could do this. And like that's one of those moments in like my recovery journey where like I feel like if that didn't happen the way it happened, like I don't know that I'd be sitting here today where I am. Because I feel like in that moment that it's like I mean, you could never understand this, but as a mom who's just given birth, when they take your child, it's almost like a primal reaction of like somebody reached into your chest and ripped your heart out, like physically. And Lisa really just gave me that space to like feel all of that. And then at the same time, like giving me hope that like I could get her back. So that's what I always try to do is just give them space and then remind them that like the fight is never over until a judge signs over your rights. That is when the fight is over. And still then you can still fight for visitation. So like we will sit down, cry, let it all out, and then like Monday morning, put your working boots on because you got some work to do. So
what did that look like for you from your perspective? So from the time that your daughter was taken and you got some hope, right? What did that hope, first of all, what was that hope? And then where did you go with that?
So the hope was that I could get her back one day, was that, you know, if I addressed, let me rewind in time. At the time, I was like, okay, whatever. I have to do whatever DCF tells me I have to do to get my kid back, which was go into a residential program where I could have her with me. So I went into a residential program, and I think my mindset at the time was like, okay, I'm just going to do what everyone else is telling me to do. And I think I really had zero like faith in myself that I could be a good mom, that I could stop using drugs, that I could like do this. And so I went into this residential program, and I was probably a few days away from getting her back permanently, and I relapsed. And like now looking back, like I can see like everything happens for a reason, but that just extended the time I was away from her, obviously. And so DCF saying the same story. They were like, if you want to get your daughter back, you have to go back to a residential program. So I went to another residential program in Lynn where I could also have her. And then I just, like, I remember when I went back out, like, the drugs just stopped working. I don't know if I was, like, in more pain than I had ever been in the times that I had been using drugs. But I remember, like, sitting in this hallway that I was living in and using drugs and, like, just hysterically crying. And, like, they were not numbing that pain anymore. So when I went into treatment the second time, I was really like desperate to just not feel how I was feeling. Like I just didn't want to be in pain anymore. So I sort of walked into treatment like, all right, can somebody just tell me how to like function? Because I can't even like get up and take a shower and make a bed. Right. So that's what I did. And I stayed in that treatment facility for 6 months before I got my daughter back. And we would do weekly like visits, which can be really, she was living like 2 hours away at the time and in a foster home. And a lot of times I lost hope. Like I remember she would come for a visit and she would sit for an hour and she would scream and cry the whole time. And that was all I got was 1 hour a week for like 3 months. And I was like, what am I even doing here? Like, this is not helping. Like, she doesn't even know me. And I lost hope a few times. And, like, thank God for the staff at the treatment facility I was in. because they saw that I was getting discouraged, and they were like, you just have to keep faith. You just have to keep doing what you're doing. And like, eventually, like, she'll come here to live with you, and you guys will build this incredible bond. And that's exactly what happened. I'm glad I stuck it out because, you know, me and my daughter have like this amazing, beautiful bond, even though she was taken from me three days after birth, and I didn't have her back full time till she was 6 months old.
Yeah.
But so, you know, I just really try to bring that, what was brought into me, I try to bring that to moms now. Like, you know, remind them that, like, you can do this. You're a fighter. You are stronger than this. Like, moms have this, like, primal strength that nobody else has. So, like, you can do this. You just have to hold on a little bit longer.
Yeah, I want to go back to, because, I mean, when you said you were in so much pain, I mean, I'm assuming you're talking emotional pain.
Yeah. Both. I had a C-section, so.
Yeah. Again, something I know nothing about. The most difficult thing I think that I find in our jobs is dealing with the clinical and medical community and trying to explain to them that this is not where we want to be, right? Because they see it reproduce itself over and over again, right? You mentioned relapse, right? And there's always that kind of feeling of like, well, they're doing this to themselves. And the disconnect is really, it's like, you know, most people who are in this situation don't want to be in this situation. They just don't see a way out. And you add on top of that you have a child that's been taken away from you, and the burden and the emotional burden of having that and going, I really want to be able to take care of this human being. I love this little human being more than anything, and I just can't. And I'm a failure, and it's just got to be horrible.
And it's a horrible cycle that just, because then you fall or you relapse or whatever, then you are back feeling more guilty than you felt before, and so you have to use more drugs to cover that guilt, and it's a devastating cycle.
Yeah, it's absolutely horrible.
Yeah.
I mean, I can definitely understand that part of it, not the part where there's a child involved, because that's just got to compound it to a degree that's just unlivable.
Yeah.
You know,
Even before I had a child, like, I never saw a way out. I thought I was destined to use drugs and alcohol till I died, because I didn't know there was another way to live. I was in so much pain from everything that had happened to me as a child, or everything I had been through all of my life, and I just didn't know how else to deal with those feelings. I had no idea that there was another way that other people dealt with feelings. I just thought everyone used drugs and alcohol. I was like, I guess I'm just in more pain than everybody else because I use a lot of drugs and alcohol.
Yeah. Yeah. So the work in the birth center, which you're involved in, right? That's with moms who are pregnant. Yep. Right. So can you talk about that a little bit?
Yeah.
I want to.
What part?
Well, you and I talked about this a little before we got on here. So I'm going to be a bit of a dick, and I'm going to tell you what I probably thought myself, and I'm also assuming that probably a lot of people think. Mm-hmm. And then I'll leave it to you to debunk it or whatever, right? So I think the and correct me if I'm wrong, but I think the common thought out there is that these are women who are taking drugs and having sex irresponsibly and most likely prostituting themselves, and they got themselves into this, and they don't deserve to have children.
Yeah. Yeah.
How's that for dickish?
Yeah. And I think this was really eye-opening for me when I came into this work. And I think I felt a little of it because I had used, a lot of my pregnancy and was still getting prenatal care and everything like that. And I just remember, like, the looks on people's faces. And I feel like there's stigma for drug and alcohol addiction, right? There's just, like, standard stigma.
Oh, really? You think so?
But then I think there's an extra, like, I think people are starting to come around that, like, substance use disorder is a disease and people can't control it and things, and you can't just stop. And I think that gets lost somewhere in the medical community, like when somebody becomes pregnant, right? So providers think like, oh, somebody became pregnant, they should just stop using. And I'm like, where's all that knowledge you had about the fact that this is a compulsion and a disease? And I think that people just can't wrap their brains around that, like, because I think we have idealized mothers so much in our society that they should be perfect. And there's this like standard for mothers. And how dare a mother put herself before her child? And forgetting that, like, underneath all of that, she's still just somebody who struggles with a substance use disorder.
Right.
She still can't just stop. It doesn't work that way. We know this. So I don't know why it seems to be a different standard for pregnant women or women who have children. They should do it for their children. And I think that, like, because I deal with it also, like, on the OB team here at Lynn Community, like, there's just this like shock and awe of somebody who walks in and they're homeless and they're participating in sex work and they're pregnant and they're living in a tent and they have track marks, and it's sort of like, oh my God, what are we going to do with this person? We have to get them into treatment. And it's like, that's the last thing on mom's mind. Like, she literally just wants to know that there's a heartbeat. And I think, and why I share my story like so openly and honestly about using while I was pregnant and having a child removed from my custody, and because I want people to know that, like, underneath all of that, there's still somebody's sister, daughter, friend, probably a beautiful human being that probably loves that little baby more than anything in the entire world and just can't stop. And, like, I always say this, too, is, like, we know it's wrong. Like, as moms, we know it's wrong. Like, I wasn't shooting heroin, like, thinking that, like, this was going to be really good for my baby. It was going to make her so smart. I wasn't doing that, right?
There's vitamin C in
yeah,
this.
It's great. But, like, and so I felt worse than anybody. Like, I already felt horrible. I didn't need other people, like, telling me how much of a horrible person I was. But I think that sometimes people forget what's underneath the addiction.
So are you saying, Tisha, that shame and belittlement are not a catalyst for change?
It's crazy, right? Crazy.
It really is. Talk about 1950s mentality.
Yeah.
Yeah, and it's having those conversations with people, because we still get them, right? The nurses and doctors that are like, do you know what you're doing to your family?
Yeah.
Yes, I do. I just can't seem to stop, right? It's like there is nothing that you can say to me that I already haven't said to myself, right? So go ahead and give it your best shot because I've heard it all and it's up here all the time, 24 hours a day.
Yeah.
So I actually had a conversation with the medical staff about a patient that had come into the ED. I think you might have sent her over, and the way that she was quote unquote treated, right? And I was asked to address this email that I sent, and I didn't address the email that I sent. And I don't know if I told you about this.
I don't think so.
But I basically,
you probably sent the email on my behalf, so now I feel bad.
No, I didn't. But I sent the email saying, oh no, it actually wasn't you. It was someone from Elliott, and so she came into the ED. With the issues were not addressed properly, and that happens. And there was some miscommunication and stuff like that. But what I said at this meeting is I'm not going to address the email and I'm not going to address the issue that happened because that's pretty clear in the email. What I am going to address is why I found it necessary to write this email and why it was so difficult for me to write this email is because people like me, people like us, and I'm 14 years sober. I'm more than 14 years sober, if that even matters, are used to being treated like crap. And not only do we expect it, but to a degree, we agree with you.
Yes.
Right?
Yes.
Right. I know. I have yet to meet an addict or an alcoholic who doesn't agree with that statement.
Yep.
Right? And people find that appalling, right? Quote unquote normal people.
Yeah.
They're like, you yes, I agree, because I tell myself that all the time.
Yes.
And if you're calling me a piece of crap, I'm going to go, wow, yeah, no,
Yeah.
you're right. You're an excellent judge of character. So there's that we're not going to complain. We're not going to write a letter about it. We're not going, and then even the people that I deal with, the quote unquote patients, clients, recoveries, whatever, I also find it hard to complain on their behalf because I still have that sense, right? Even though I am now supposedly a productive member of society, I still have that internal thing that's going, but are you? Are you really? Or are you just kind of faking your way through this, right?
Yeah.
And feeling found out every time someone says you're a piece of crap or they're a piece of crap.
Yeah.
So it's a very difficult position to be in. And then you're in a position of having to advocate for people that you know have a stigma attached to them, and it's even a larger stigma if they're pregnant, right? Because now not only are they bad human beings, they're bad mothers.
Yes.
Right? And part of you, even though you don't want to, is like going, well,
can't you just stop?
I mean, I see what you're saying, but right?
Yeah.
And that internal struggle that goes on that you know, I find myself when I'm advocating for people, I almost have to, I don't want to say fake it, but I almost feel like I am faking it, right? I almost feel like
Sometimes.
It's
but
hard to
sometimes
describe.
I feel it depends on who I'm working with, because some people, like, just in sitting with them, you get that glimmer of like the beauty of their soul almost, right? When you're like sitting with somebody and you're just like shooting the and you're just having coffee, or they're talking about their hopes and dreams and everything that they hope to aspire to. And so for me, I almost feel like sometimes I'm advocating for not necessarily the person they are in that minute, but the person that I know is underneath all that. If that makes sense.
Oh yeah, absolutely. So what is that like? You the birth center, I assume, calls you, has you come in, has a mom that they want you to work with, right? And what is that? And then are you isolated a little bit from DCF, or is DCF already involved, or
It
like,
depends.
how does
It just depends. So the doctors I work with deliver at Salem Hospital. So a lot of times I'm working with mom pre-delivery. So I'm already like pretty much on call. So like, call me when you have the baby and I'll come up and visit you at the hospital that way. And I always tell them, like, if you have any issues, the way you were treated or anything like that, just give me a call and I'll like make a call. So it just depends. And then also at the same time, the nurse manager from the birthplace will call me if she has, like, you know, almost a year ago, she had a mom that had come in that had been using her entire pregnancy and was ready. And she was like 9 centimeters dilated when she came in. And I actually came up, they had already called DCF. DCF had already made the decision they were going to remove custody. And I came up and I just sat with mom and I just sort of asked her, like, what do you want to do? And she was like, I want my baby. And I was like, okay, well, you're going to have to take some steps that you probably don't want to take. And so she was like, I'll do whatever it takes. So I was able to get her a bed, actually at the same treatment facility that I had gone through, where she could have her baby. And she was discharged, I think, like a day or two later, and went to that treatment facility and probably detoxed still on that couch there, but completed that treatment facility. And so I got to see that all the way through, which was amazing.
And she has her kid? And
She has her kid, and everything was great. But yeah, so it just depends on like where the referral came from. I've had DCF workers call me too, like, hey, I have this mom that just delivered. She really could use some support. So it really, really, like, it comes from all over.
So you've really kind of worked on, I'm assuming, putting the word out, and there are different. Because what I heard you say that I really liked, that kind of piqued my interest, was DCF workers are calling you and saying, I have this mom that could use some help.
Yeah.
That's pretty cool.
Yeah. So we've done
So they're not just evil trolls looking to take away children.
No. There's, we've done a lot of work with our local office, a lot. So, they know me by name. I've gone there. I've shared my story. I've shared with them, my struggles and where I'm at now, and sort of giving them that. Sometimes I feel like that's what people need, is like that hope shot, that like, because I feel like obviously, if you're meeting a DCF worker, it's probably not the best time of your life, right? So they're seeing people at their worst. Same at Salem Hospital or in the special care nursery, right? They're seeing mom and baby at their worst, probably. So I love going and sharing my story and showing the other side, right? So showing, because they don't see that. Mom and baby are discharged and they never hear from them again. Or DCF closes the case and they never know if mom continued to do well or not. And so I think that's really, really helped, personalize me, right? So I'm not just this person that's like yelling at all of their
Right.
DCF workers or their staff, but also just helped like develop this like open relationship. So a DCF worker can call me and be like, hey, this person's smoking weed. What do you think about that? And not necessarily talking about a specific case, but just talking in general, like, what do you think about smoking weed? Which I think allows for this education to go back and forth, which I think is great.
And what do you think?
I mean, this is the conversation I have with the moms I work with, right? Are there any consequences to you smoking weed, right? Are you gonna lose your housing? Are you, not being in compliance with DCF? Are you not in compliance with probation? Are there any negative consequences that are going to happen if you smoke weed? And if the answer is yes, and you continue to smoke weed.
This is post-pregnancy.
This is post-pregnancy or even during pregnancy. Even the medical community is very split on smoking weed in pregnancy.
I know.
So
I don't think they're that split on using heroin.
No, definitely not. So I choose to keep my hands out of that. I'm mostly just focused on like, can you function when you smoke weed? And because I feel like, and listen, I'm abstinent. I work a 12-step program. That's like how I do my recovery. Tangent could come from this. But anyways, so if the answer is yes, and you're continuing to smoke weed, I think we need to look at that a little more, right? We need to look at like why you're continuing to smoke weed despite the negative consequences, because I feel like that's part of an addiction, right? If there are no consequences and you can get up, take care of your children, go to school, go to work, whatever you need to do to like function, I don't really see it as a problem.
Yeah. Well, I mean, I think I can't remember who it was. That's someone from Healthy Streets I had on the show. I'll remember his name and it'll be too late. But he basically had this one liner. He goes, "Look, we're an intoxicated society, right? And that's what we do."
Mm-hmm.
I'm the same as you. I'm abstinent, and it's basically I don't do anything mind or mood altering.
Same.
And that was from my AA.
Yeah.
History and the groups that I had attended and what I did with that. And that's my choice, right? I don't impose that on anyone.
Yeah.
And I'm kind of the same way. Is this affecting your life? Or, I mean, one of the things that we have that's very difficult, and I hate to say this because of people who might be listening, right? Who pay our way through this. But we have a job where the expectation of failure is so high.
Yes.
That it's really hard to fail at this job.
Yes.
Right? I mean, what other job do you have that's like, oh, I've got a 10% success rate? That's awesome. Good for you.
Yeah.
Right? So we've been trying to figure out this way of what is a good measure of success, and abstinence is not.
Yeah.
Right? Complete sobriety is not. But you can measure success, and I'm kind of making a pitch for my theory here. You can measure success by, have there been improvements in your life?
Yeah.
Right? Has the quality of your life improved in these areas that have happened because of your slowing down, switching over?
Yeah.
Right? It's like, can you say that someone who was living under a bridge or, in their car or in a tent shooting heroin every day, right, is now working, going to school,
Right.
back with their family, and maybe going on a bender on a Saturday
Yeah.
night with booze
Yeah.
as a success, right? Well,
Yep.
because that's what the guys at Wall Street do, right? Along with microdosing acid and stuff, right?
Yeah.
But, so, and I also know people who function quite well using heroin every day.
Yeah.
I mean, there are those people.
Yep.
So I guess what I'm curious about is, what are some of the more challenging things in that particular job that, like, in a perfect world would work better?
They wouldn't take any kids away. No. No, because that really is probably the most devastating part of my job. We had like 4 removals in 1 month one time, and it was hard. At the end of that month, I felt like broken and beaten, and like I wasn't doing anything right, and like, what? Now what? But
Well, let me just stop you right there, because, I mean, you said something earlier, right? But there is an argument to be made for removing a child from a situation that's potentially dangerous.
Absolutely.
Right? So, that said, I'm guessing now, because I've seen it, so maybe I'm not guessing, that there are situations where, in our estimation at least, knowing what drug and alcohol use is like, there are situations where perhaps the social worker or DCF worker jumped the gun and may have overreacted.
Yeah.
Is that fair?
Yeah, fair. Okay. Also, caveat to that is, like, they sometimes operate out of a fear place, which I think is human, right? So they have seen, I mean, I had a social worker share with me that she walked in to an apartment to do a check on a family she was working with, and mom had been dead for a few days, and there was a 3-year-old just in the apartment by herself. So, I mean, I can understand that, human to human, that you're going to now operate out of a fear place. So anybody that's using drugs need to take their kids until they stop using drugs. I get that. At the same time, I work a lot. We've had this shift in practice, sort of not necessarily rushing to a file every single time we have a positive urine drug screen. And so I've had a lot of opportunities to work with moms on safety planning. So usually what happens is, if you have a urine drug screen, you have a positive urine drug screen, and you have a child in your care, we're going to now work on, what is your safety plan? Who else is around you and your child? Like, what, if you are going to use drugs, like, what's your plan with your child? How are you going to make sure you're not taking care of your child while you're under the influence, and et cetera, et cetera. But so I think I'm always operating in the gray, right? I'm always in the gray. I feel like I'm always in the, is this child safe? But then, like, at the same time, like, first and foremost is the vulnerable population, right? So I'm always making sure that baby's safe. But mom's the person I'm working with. So, I mean, I just had a removal yesterday where the child was removed from mom's custody, and I was part of that file. And so I reached out to mom, and I was afraid she was going to tell me to go F myself. But she actually, like, engaged with me. And so we're going to meet later and sort of come up with a plan on what she wants to do. But that's the thing, is, like, that's really hard to, like, on one day make the decision that your child's not safe with you, and, like, I have to tell somebody that. And then the next day go and sit with you in that pain that I almost feel like I caused.
Right. Oh, yeah. Yeah. No, that's a good point.
So.
Right. Yeah.
It's all messy.
Yeah.
It's all gray.
I'm here to help you with the situation that I got you into
caused.
And had to do.
But be honest with me.
Right.
You see how far that got you?
Right. Exactly. Yeah.
So.
Yeah. That's gotta be a little crummy.
Yeah. Yeah.
So how does?
I definitely go home and, like, hug my kids extra tight and try to breathe when I leave work before I show up at my kids' daycare, and sort of, like, exhale it all out because it's not mine. I carried that pain of my own removal for a long time. I can't carry anybody else's pain around with me. It's not good for me. It's not good for them because I'm not actually lessening their pain by carrying it. So, no, nobody can lessen it.
Well, I mean, but the thing is do you find more people are telling you to F off, or do you find that most people are pretty receptive and understand your position?
I feel like the most common thing that happens is people tell me to F off and then call me 3 days later looking for help.
And go, you were right. Can you help me?
Can you help me?
Can you help me get my kid back?
Yeah. That's the most common scenario.
Do you enjoy this?
The work that I do?
Yeah.
So much.
You find it rewarding?
So much. One reunification trumps 10 removals. That joy is so great that, I would do it forever.
Yeah.
Yeah.
And do you find that a large percentage? I mean, are you seeing a large? This is like a really an unfair question, but are you seeing a lot of reunifications? I mean,
at this very moment in time.
Yeah, and I'm not saying this is a reflection on the job that you're doing. I think I'm kind of trying to unfairly gauge a mother's unconditional love for her child, and would she go to any lengths to be reunited with them? I know, like I said, grossly unfair.
Yes. So yes, I think 6 or 7 times out of 10, we're seeing a reunification.
Really?
Yeah.
Wow, that's huge.
Yeah. No, I think that's
enormous, Tisha.
Yeah, the mom's desire is so great, and that's the other thing that I love about my job is watching moms because it is a boxing match to get your kid back. You have to, and I use this phrase because this is what my mom told me. She was like, if they tell you to stand on your head and spin around 10 times to get your kid back, do it. And so a lot of times it is just walking on a minefield and, I got to do this, and then I got to do this, and then I got to do that with minimal support. And so to watch them claw and fight their way out of this is so inspiring to watch the strength that took. When it almost feels like everyone's not rooting against you, but the odds are not in your favor. But yeah, I mean, I think that moms do have this unconditional love for their child, and they will go to the ends of the earth for them. And yeah.
Mine's pretty conditional.
Yeah.
No, I'm being a dick again.
Well, there's always the exception. But
so will they initiate Suboxone or methadone during pregnancy?
Yes. Yeah. So that's standard practice. That's best practice is to, if you have a mom that comes to you newly pregnant and she is either struggling with using opiates or is newly sober, whatever word you want to use, from opiates, say they've only been in recovery for 3 months and they find out they're pregnant, most likely the doctor is going to recommend medications for opiate use disorder, just as a protective factor for mom and baby.
So is there any truth to and this is only something I know anecdotally, is that with Suboxone and methadone is basically the mother gets very little because the baby's like this parasite sucking up all
There's a gram of truth in that.
All the medication.
There's a gram of truth in that.
Okay.
No, but yeah, so as you get farther along in your pregnancy, and it's not so much that the baby is taking more, but as you get more and more pregnant, your, and I'm going to mess this up because I'm not a doctor, but I've heard the talk so many times. Your total blood volume or your total, the amount of fluid in your body expands so much that you need more Suboxone or more methadone for it to work in order for you to not go into withdrawal.
Oh, okay. So it's not so much that
baby's sucking
that
it
the
all.
baby's sucking it all up and is a parasite.
No.
It's that the volume that's necessary because of the volume that's in your system has increased.
Yes.
So the volume to be able.
Yes.
Right, I get it.
Yes.
Okay, so it's a
Yeah,
it's
yeah.
a question of
Yeah.
there's more volume in you.
Yes.
So you require more medication
Yes.
in order for it to be effective.
Yeah.
Okay.
And we always, I mean, we don't want someone sedated, but you err on the side of more than less because withdrawal can be really dangerous for an unborn baby and for mom and can cause like preterm labor and things like that. So you really do want to err on the side of more rather than less. But yeah.
So let's go back to my original ignorant question. I'm going to ask it and maybe cut it out if it's really a horrible question to ask. But we all know how pregnancies happen, but how are the like a good portion or a majority, or is there a majority, or is there?
The majority of the time it's a mom and a partner is what I work with.
Yeah. So it's people who are couples and they're using, or she's using, or they're using together, and they're having sex like a normal couple would, and she gets pregnant.
Yeah. I mean, that's how I got pregnant. I was with somebody in a relationship. I mean, we could call it a running partnership if you want to call it that. I mean, it felt like a relationship to me at the time. And I literally thought I couldn't get pregnant. I didn't know if it was the drugs or if like I had like something wrong with me. I like had been having unprotected sex for a long time and I never got pregnant.
Right. But you were a couple.
Yes.
Right. I mean, you say a running partner, but I mean, the Clintons are a couple.
Yeah.
The Obamas are a couple. Bonnie and Clyde.
Yes.
Bonnie and Clyde were a couple.
Exactly.
They're all moving in the same direction, right?
Yes.
It doesn't. So, you were involved in a relationship. You got pregnant,
Yes.
as people do, and voila.
Yes.
Right.
Yep.
And then the rest is history.
Yes.
Is this the one that was playing T-ball on Sunday when you blew me off?
Yes. Yes. I knew you were going to bring that up. Yeah. T-ball takes a lot out of you. Have you ever been to a T-ball game?
So anyone listening, don't make any appointments with No.
Oh my gosh, no.
So listen, we're almost an hour into this, believe it or not. Yeah, I mean, time goes very quickly doing this. I was a little nervous because I hadn't done this in a while, and I'm always afraid that I'm going to have nothing to say, which I can talk, for 3 hours standing on my head. And I want to ask you what I like to ask everyone is there anything that you feel I should have asked you that I didn't, or any questions that you think weren't answered, or for that matter, anything that you wanted to talk about that I didn't bring up?
No, I don't think so. I think we pretty much covered the messiness that is working with pregnant and parenting and moms. Yeah.
And so
it's pretty messy, I feel like.
Yeah, I don't even think we scratched the surface.
Yeah.
I think, but I think this was a good introduction to you. I'd like to have you back on.
Yeah, for sure.
I hope you at least enjoyed this.
I did. It was fun.
All right.
I was a little nervous too. I'm not gonna lie.
Yeah. Well, sometimes that's good. You did a wonderful job, and thanks for coming on.
Yeah, no problem. Anytime.